We are on your side tonight, speaking one-on-one with North Carolina's leaders in the fight against COVID-19. We mentioned this earlier in the show. We told you Secretary of State of Health and Human Services, Dr. Maddie Cohen, announced that she was stepping down from her position after 5 years. Just this afternoon, our Maddie Gardner spoke one-on-one with Dr. Cohen about being a leader through one of the most challenging times in North Carolina's history.
From the early days of the COVID-19 pandemic.
The reason COVID-19 is so different is we don't have a vaccine, we don't have treatment, and it is very contagious.
Through the worst surges.
I am very worried.
Dr. Maddie Cohen led North Carolina's response to COVID-19 as Secretary of the Department of Health and Human Services. Last week, she announced she's leading the role and the podium we've become so used to seeing her behind.
What was the catalyst behind that decision?
Well, it has been an amazing 5 years in this role. And, it was the right time for me personally and professionally to think about what is next. But also I got to watch my team really come together and respond to this pandemic so well. And I feel like I can pass the baton to one of my longtime deputies to run the next leg of this race. So they are ready and I am ready.
Best known for her prominent work during the pandemic, Dr. Cohen came to the State Health Department in 2017, years before the first case of COVID-19.
Do you remember what your mindset was and your perception of this position was going into it versus what it is now, leaving this position?
Well, I was really excited to take on the role, one, to work for the new governor, Roy Cooper, and really think about how I could take his vision and turn it into reality for North Carolinians. I was also really attracted to the fact that this is a very complex and large department, but it gives you these levers to bring together in service of health. So I'm not just the public health director or just the head of Medicaid or mental health. We actually get to bring all of those levers in addition to early childhood, education, economic services together in service of our communities and our state. And so that was really exciting to me. And as I leave, I think it is one of the assets of North Carolina to have this umbrella of health and human services together. I think it's what made us strong during the pandemic. And so I think we've done a lot of work to strengthen the department over the last 5 years. So I'm really proud of being able to pass the baton at this time and then to keep on running.
Those last 5 years included leading the agency's 17,000 employees and managing a $20 billion budget, something most of us did not see, focused instead on her updates throughout the pandemic.
So, while case numbers are lower, this is probably an incomplete picture of what's happening in our state given the low amount of testing last week.
How do you want people to remember you as you serve the state?
Well, I hope they see me as a strong leader who was trustworthy, that really could understand what folks were going through and tried to navigate these uncertain times with them. I hope they remember me as someone who put equity at the center of the work, and that really tried to think holistically about health for our state. Wasn't just about access to a test or a vaccine, which are very important, get vaccinated, but to think about all components of someone's health, and how do we bring levers together from all parts of the government and the private sector in service of that. So it's, like I said, an honor of a lifetime to be able to serve at this moment.
Dr. Cohen's successor takes over at the start of 2022. While she wouldn't yet say what's on the horizon, she hopes the state she's worked for the last 5 years is part of the years to come.
Well, I'm looking at a range of opportunities to continue the work I've started here in North Carolina, but I hope that the work will keep me here in North Carolina. I and my family love it here. And so we hope to be able to continue to raise our daughters here in North Carolina, but not sure exactly what the next chapter will be, but it will be in the health and well-being space, and making sure I can continue to try to have impact at scale to build healthier communities.
Is our Maddie Gardner reporting. Excellent interview. You can watch more of that interview with Dr. Cohen right now on WBTV.com.